Okay, for this lab, we're going to be separating our casts from our pumice and plaster, so you're going to peel off the red boxing wax. The thing you want to make sure whenever you are hitting the pumice and plaster to separate is make sure you hit the pumice and plaster, don't hit your cast. If you hit your cast, you can break it. Now, sometimes you're lucky and you're sitting there trying to find a seam in order to hit this and it'll split apart like you see here. But most of the time, you're not going to get that lucky and you're going to have to actually put a little bit of force into it. The problem that most students have whenever they go to separate these materials is they just start kind of very lackadaisically hitting it. You want to hit it with a very firm stroke, like you're really trying to knock them apart. So you see me kind of tapping here, but then you'll see me change, and you're never going to separate it. You can see how now I'm hitting it with a lot of force. Again, you want to make sure you just hit the cast. I'm sorry, the pumice and plaster, not the cast, and usually they separate relatively easily. A little bit of residue. Then you're going to take a buffalo knife, you're going to get through your impression material to the tray, and then you're just going to gently twist on the handle and that will lift up the tray off of your cast. If you've poured everything appropriately, you should have no problems with things breaking or anything like that. The next step is you want to actually trim the vertical height of your land area. So we're going to take a burr on a straight hand piece and we're going to trim the height. Now you want to maintain about 2 to 3 millimeters of that buccal upturn of the vestibule. You want to maintain the length and width of your vestibular extensions. You've captured that, spent that time border molding and capturing that in your impression. You want to maintain that in your cast. On your typodonts here, if you're working on the simulated project, you have a little bit of a land area of your typodont patient, so you have a little bit of a cheat. You can actually go just a little bit below the depth of the typodont patient is probably a little high, so you could probably reduce the land area height a little bit more, especially if that helps you get rid of any defects. So you're going to go across the maxillary arch, you're going to go around the mandibular arch. The most important area to make sure you have a good land area is this buccal, distal buccal extension that we're in right now, headed up towards the retromolar pad area. That tends to be a very common area for students to either in their boxing or their trimming to over trim. Again, this posterior area, we want to potentially trim this down so it's nice and flat tongue space. It's a little bit built up here because of how it was poured. And so we could take a burr, and you'll see me outline here as far as the kind of the shape that it's supposed to have. With our model trimmer, we're going to trim it back a little bit, so we're probably going to eliminate most of that in the model trimmer. When we go to the model trimmer now, we've trimmed the height where we want it to. We want a flat surface that's parallel with the residual ridge. And then we come in and we can now trim it laterally to get that nice 3 to 4 millimeter wide land area. Again, this allows us, by trimming the height of it first and then coming over to the model trimmer second, allows us to really be able to control the thickness of that land area so we can have a nice consistent 3 to 4 millimeter land area all the way around the cast. So constantly dumping the water out so I can make sure I can clearly see the land area. And again, like I said, you trim it vertically first, then on the model trimmer second, and then you can end up with a nice uniform thickness of that land area. Now you do want to trim the height of it after that if you feel like it's too thick. Same thing in the mandibular arch, trim so we have a flat surface to work with so that we're parallel to the residual ridges. And then we're going to go through and do the exact same thing, just trimming it laterally so that we have a nice uniform approximately 3 to 4 millimeter wide land area all the way around. Posteriorly, we're going to make sure we have a land area along, again, this distal buccal area that we're going across right now. But then we want to make sure we have about 4 millimeters of a land area behind our retromolar pads. And so we're going to be trimming that off in order to get that 3 to 4 millimeters behind the retromolar pad. You can see for this cast we trimmed off that tongue space. Now I'd go in with a burr and trim and make that tongue space area relatively flat. Then you're going to put it back on the model trimmer, same thing the maxilla, to maintain the thickness to get the appropriate about 1 centimeter thick. Then you want to dry it off just a little bit. The stone will be wet at this point, so your burr may not cut things very well at first, but here I'm using the gold burr, And what we're doing here is we are cutting in the notches that we need for our mounting stone to be able to flow into these notches, but at a later step we're actually going to separate the mounting stone from the cast. And so we want to be able to have positive notches that we can take and re-index them back together. Also, they need to be broad enough and thick enough so that the stone that goes down into those notches won't just break off in the cast when you go to separate them. So again, there's nothing magical about the position of these notches. You just want to have about 3 good notches across the cast. Again, in case the lab is going to trim things away, you want to have relatively significant notches. So you can see these aren't little notches. You'll make them a little bit thinner if your cast is a little bit thinner, but you want to have 3 good solid notches. So the same thing we did on the one arch, we're going to come back up and do that same thing in the other arch. So again, trimming, making sure it's relatively smooth. You can go back in and use some kind of a sandpaper, a fine grit sandpaper or something like that to make it a nice smooth surface. When we actually do go to mount these casts, we are not going to be putting scratches in them because, again, we do want to separate them cleanly from each other. So these notches are the only index that you're going to have in order to reorient the cast back to the mounting stone. So here we've completed all the debris that you see on there. We want to rinse off completely. Now when we go to carve our posterior palatal seal, we want to carve slightly over the hamular notch area. So we want to carve a single groove about 1 to 2 millimeters deep along the vibrating line. The line that we've created on our impression transferred to the cast. So we're going to carve this back. So again, just over the hamular notch, I'm going to extend this little bead that I'm going to put in, but following that posterior line where the vibrating line was, we want to put this initial groove that's going to be about 1 to 2 millimeters deep. Now for your typodont patients, we don't have anything that we've palpated that we've transferred from the impression, so we're going to be using the fovea palatini as our reference for the vibrating line. So we're just going to kind of arbitrarily draw a line from hamular notch to hamular notch across the fovea palatini in our simulated patient. Here again we carve across that 1 to 2 millimeters. Now extending up to where that anterior area of depressible tissue is, that's where we're going to carve out the cast. So it's going to taper. So the deepest part of this carving that we're doing is that vibrating line area, or that posterior palatal seal, the most posterior part. So that 1 to 2 millimeter bead we took from hamular notch to hamular notch. Otherwise, we're going to have the material carved out from that vibrating line that we've carved out all the way up to the anterior extension of the depressible tissue. So it's going to taper out as it goes more anterior. So the deepest portion of those areas is that, again, that posterior bead that we've placed in the cast initially, and then it's going to we're going to carve it out up to the anterior extension of the depressible tissue, but it's going to get shallower and shallower as you go more anterior. As you go to the hamular notch area and across the mid-palatal suture, it's going to get a little thinner, but you still want to bevel those areas. Then after you've carved in your posterior palatal seal, normally on a patient you would block out any undercuts with wax. Then we're going to come in with a lubricant. Now for our simulated patient, we don't have to block out any undercuts. But if you were doing the same step on a live patient, you would want to make sure that you blocked out any undercuts or any sharp areas in the stone that might break off whenever you add your record-based material. So we're adding a very generous amount of Vaseline to the cast to make sure we have a good lubricant. And we're going to go through and do the same thing in the mandibular arch. Again, just applying a very generous layer of Vaseline across the entire surface of our casts. Again, if it were a live patient, you'd want to add wax to block out any undercuts. Now we go to applying the base material. Again, we want to use the pink triad base material. We're just initially here adapting it with our fingers. You don't have to use an instrument too much whenever you're applying this material. Actually, the best instrument you can use with this material is your fingers. You can get the material very smooth, and you can control it very well with your fingers. Now remember, we border molded this vestibular extension. A lot of students confuse the base material with the tray that they made a couple of appointments ago. Remember, with the tray, we purposely made the tray 2 to 3 millimeters short of the depth of the vestibule. But with this material, remember, we have gone through and we border molded and we got our impression and we captured this vestibular extension exactly the way we want the final denture to be. So we want to take this material, and I'm actually filling in the vestibule. So you can see I'm patting this material with my finger to make sure it's very well adapted, and then you can take your finger and just kind of rub it, and that really blends the material. It gets rid of any creases or any lines. The only time that you're going to see me using an instrument is to get rid of any excess material. The most part, you're going to see me using my fingers just to adapt this material to smooth it. If you're going to leave any area a little bit thin, I would tend to leave the crest of the ridge area thin. This can potentially be an area that gets in the way when you start to set teeth. So if it's a little bit thin, I don't have a problem with that. So we go through, again, trimming off. That's the only time you're going to see an instrument is whenever we're trimming off a little excess. If for some reason we find a little bit of an area where we need to add a little bit more, you can take some of that excess that you trimmed away and roll it up and apply it to areas where you may not have enough material initially. But you want to go through and keep adding. You're going to keep adapting and filling in that vestibule, and again, massaging the material, just rubbing it with your fingers. You can get rid of any creases. You can end up with a very smooth, very neat, shiny surface if you just keep using your finger and manipulating it. You want to be a little bit careful not to incorporate air bubbles underneath the material, so how you apply it is going to be important when it comes to not incorporating air bubbles into the mixture. Okay, once we have that adapted well, then you want to take and cut out a section of either the black wrapping material that the material came in, or you can use a piece of foil. Again, we're covering the palette because we want to make sure that we decrease the polymerization shrinkage. So you're going to put that in the curing unit for about 3 minutes, and while it's curing, then that the ridge area is curing, but the material underneath is not. While that material is curing, you can move on to the mandibular arch, and again, the same thing with the mandibular arch. You're going to trim off the tongue space area. I usually leave a little bit of excess so I can take that excess and roll it up. Again, we've spent time border molding and getting our impressions so that we have the proper extension both in length and in width of this vestibular extension, so we might as well capture that entirely into our record base material. So again, just filling in the vestibule, adding material, using my fingers to adapt it and smooth it. Here I'm working with the lingual side first. Again, there's little extensions that you can always take a little instrument and trim off. Again, I want to trim off just a little bit of and leave a little bit of excess on the buccal. Then I'm going to take and I'm going to roll it in. And if for some reason, like I said before, if you feel like you have a little bit of a void, you can take some of the material that you've trimmed off. And then what I usually do is I just roll it up into a little roll, and then I adapt it into those extensions. Again, just continually adapting and smoothing with my fingers so that I have a nicely adapted record base and a smooth record base with this material. So again, just extending around the buccal side, continually trimming off any excess, rolling up the material, again filling in the vestibule. It's important that we have the proper extensions of this. We want to make sure that if we're going to have any issues, maybe we have a slightly overextended impression, that we might see some of that at this stage so we can correct for it so that our final prosthesis doesn't have those same problems. So those are several advantages of being able to put these extensions into our record base at this point in time because we can evaluate it for our final denture. Again, remember you have that land area behind the retromolar pad area, so make sure you stop where the patient's mouth ends, not where you don't want to cover the entire land area of the patient, because then it won't fit back in your patient's mouth. Okay, once I have that smooth, then I can put that in the curing unit and I cure it in there for a 3-minute cure. When I go back to the maxilla, I take off the material that I used to cover the palate, and then I'm going to readapt it, smooth it out, and then I'm going to take it and put it back in the curing unit for 3 minutes. Once it's done with its 3-minute cure, I want to very gently lift the record base off of the tray or off the cast, and you're going to find that lots of times this vestibular extensions are not cured yet. If you find, which you often will, that the vestibular extensions have not fully cured, then you want to put the record base back on the cast, again just ensuring that it's seated down all the way, and then you want to come back and you want to, as vertically as you can, so it comes as straight off as you can, you want to take it off, and then we're going to flip it upside down, and we're going to put the record base now back into the curing unit for approximately about 30 seconds. You don't need a long cure time to cure these vestibular extensions, but you want to make sure they're nice and cured. So I'd leave it in there for about 30 seconds. That will give us a nice solid vestibular extension. Then the last thing you want to do is you want to paint on the air barrier coating, and you want to again put air barrier coating on both surfaces. The air barrier coating is allowing the material, the very outer layer of the material, to cure. It needs to be in an oxygen inhibited environment. And then make sure you wrap or fold up a paper towel or something like that, because you don't want to just take this air barrier coating on this tray and stick it into the unit. That gets a whole bunch of air barrier coating all over the table, and ultimately you have to replace the table or sometimes the unit if you do it enough. But make sure that the paper towel is short enough that it still allows the record base to turn, or the table to turn. If you have too much, it'll sometimes hinder the table from being able to turn and curing everything effectively. Again, when you're going to the mandibular arch, you're going to do the exact same thing. You're going to very gently, once you've cured it for the 3 minutes on the cast, you're going to lift it off. You're going to evaluate your vestibular extensions. If your vestibular extensions are still soft, then you want to very gently place the record base material back onto the cast, again ensuring that it is adapted well to your cast. And then the same thing as the maxillary arch, you want to, as very easily and gently, you want to try to lift the record base vertically straight off of the cast. That way you ensure that you're not distorting anything. So here we've adapted it. Now we're going to go back in, usually in the retromolar pad areas where you're going to have some of your best success because the material is the most cured in those areas. But you want to just gently lift as vertically as you can. You want to lift the record base material off of the cast. So the more gently you can do this, and the more slowly and vertically you can do it, the less distortion that you're going to have with those vestibular extensions. So again, lifting it off, then you're going to put it in the curing unit for about 30 seconds. About 30 seconds. Then same thing with the maxillary arch, you're going to put the air barrier coating again on both the internal and the external surface, and then you're going to put it on a paper towel and put it in the curing unit for about 3 minutes. Once you take it out, if you have any little blips or anything like that, that's going to hinder the cast from seating. You want to adjust that. Plus there's sometimes you get a little bit of flash where you had some material extend out onto the land area. I don't want to do anything to my vestibular extension. All I want to do, as you can see here, is just trim off any of that excess flash that covered the land area of my cast. Once you've done that, then you want to heat a sheet of base plate wax. Again, you want to continually heat it until you can get it pretty dead soft. So it's very quickly taking it over the flame, moving it around, heating different areas. You don't want this material to get liquid, then you burn your fingers. Then you're going to roll it up, And then the first thing you want to worry about whenever you start placing this first piece of wax is the overall shape of the record base and wax rim that you're creating. Now, these initial record bases and wax rims are going to be the same thing no matter what patient I'm going to see. So I'm going to make them the same dimensions. You saw I'm looking anteriorly to make sure that I have that anterior area curved. I want to keep it about 8 millimeters out from the incisive papilla, from the center of it. I want that anterior segment curving like the curve in the ruler, and then from the canine's back it's going to come relatively straight. Once I feel like I have that overall shape the way I want to, then you're going to take a very hot instrument. This is very key to having the wax rims actually adhere or stick to your record base material, is to have a very hot instrument. Some people add some sticky wax onto the record base before they add their wax rim. That helps. But you can see with the smoke coming up just how hot of an instrument that I'm using at this point. So again, using a very hot instrument, I want to sear the wax to the record base. If you go through and you don't feel like you're really searing the wax, then you want to reheat things back up, and you want to, again, re-sear everything, because you want to have a really hot instrument so you can sear the wax to the record base. There's nothing worse than whenever you're working with a patient and all of a sudden having the record base actually break off or fracture off and you have it in your hand. So once I have that initial layer of record base on there, I want to take it off and I want to evaluate everything again. So I want to look straight down at the inside, find the incisive papilla. Here I'm outlining where the incisive papilla is. And then I want to take the ruler, and from the center of the incisive papilla, I want to hold the 0 at the center of the incisive papilla, and I visually look anteriorly 8 millimeters. And I make sure that that facial surface of my wax rim is approximately 8 millimeters out from the center of the incisive papilla. Once I have that rounded shape. Now I want to add some wax onto the areas where I have voids. So again, I'm applying this material, applying some soft wax that I can manipulate. Again, that initial layer of wax that I placed onto the record base and wax rims is both solidly adapted or seared to the record base, and it's hard wax now because we've cooled it, so I can apply this material. Here we were just maybe a little bit short as far as our distal extensions of our record base and our wax rim, so we're adding a little bit more wax here posteriorly. So here we have a decent overall shape. We have some of the spaces filled in. This is where coming in with some kind of a hot instrument. In this case, I'm using a large plate that's made by a company specifically for dental purposes. You could also use a metal spackle knife that you could buy at a hardware store, and that'll do the same thing. So I heat it up, and all I'm going to do here is all of this wax that I've added. I just want to make sure that I have that overall shape, that I have a nice contour to my wax so that it's nice and smooth. So that's all I'm doing here, is just taking that excess and smoothing it. Okay, once I've kind of got the buccal surface nice and smooth, I'm going to take it and put it back on my cast. Make sure you don't have any excess wax that's flowed on the inside. And the first thing I'm going to do is double check everything. So I'm going to come through and I'm going to measure that 22 millimeters. So we want to establish the length. So I put a little mark here at about 22 millimeters up from where that frenum attachment is. Posteriorly, the hamular notch, which is right about where my thumb is at. Most places will say 6 to 8 millimeters. I usually make it maybe 10 to 15 millimeters. Make it a little higher. That way you can always take a little bit of wax away. Now with those 3 marks that have been established there, now I can go back to that hot plate again. And that's the nice thing about having something as large as this, so that I can actually sear the whole thing at one time, so I can have a nice smooth flat surface. And I want to sear my wax rim down to where I have put those 3 marks. So approximately 22 millimeters up from that frenum attachment and about 10 to 15 millimeters vertical from the hamular notch area. This is just going to be a little bit of a too tall of a wax rim, but I'd rather have it a little bit too tall than not tall enough. Again, we only need to go back to about the distal of the first molar area as far as our wax rim, so I'm trimming it off. The problem with having those extensions is they will interfere with the retromolar pad area of the mandibular cast. So you only want to go back to about the distal of the first molar, maybe a little bit into the second molar area with the wax rim. So once I've trimmed this, now I want to go through and clean it up, fill in any little bubble voids, and make sure it looks nice. So again, 22 millimeters vertically there, about 10 to 15 millimeters posteriorly from both sides. Again, 8 millimeters from the incisive papilla, rounding like the ruler from canine to canine, and then going relatively straight back. Here we're double checking that 8 millimeter extension. So that's what we're looking for as far as our rim. So again, just showing you a pictorial view of what we've just made. Again, a little bit thinner in the anterior area, a little bit thicker as it gets posterior, but that allows us to have something solid for when the patient bites together. Again, about 8 millimeters out from the incisive papilla. About 22 millimeters down from where the frenum attachment is where we want it vertically. And then about 10 to 15 millimeters is usually, that's going to give you plenty of height of the material from the hamular notch to the vertical height of this material. And that's the maxillary rim. As we move to the mandibular rim, the first thing you want to do is you want to put some marks on your cast. So what you see me doing here is I'm circling the retromolar pad, and then looking straight on, I want to divide it into thirds. And that line that denotes the middle and upper third, or 2/3 up the retromolar pad, I want to kind of move that line off to the side. Then where the mandible starts to elevate, I want to put a line out on my land area for where the mandible starts to elevate there posteriorly, and then over the crest of the ridge. So centered over the crest of the ridge, and if that line just imaginarily continued off to the land area, that I want to put a mark there. So again, you can put it on, you can put the record base back on, and you can still see your marks. So here we're showing you a cast with those 3 marks on it. One where the mandible starts to elevate, one 2/3 up the retromolar pad, and one that's centered over the crest of the ridge. Again, you can actually do this on a patient if you want to draw a line over the crest of the ridge to mark that line on the posterior land area where the center of the crest of the ridge is. That just helps you draw it. Also, you want to make sure that you look laterally. You see where the mandible starts to elevate. I drew a little line across the cast where the mandible starts to elevate, and then I took that line and extended it out onto the land area of the cast. And then looking straight on to the cast, dividing it into thirds, the retromolar pad, that's where we get the 2/3 up the retromolar pad. So those are the 3 lines we want to draw on our cast. Now the elevating of the mandible line we're not going to be using for this wax rim stage. That will come later into setting teeth. So again, just like in the maxillary arch, whenever I apply this wax onto the record base, I want to kind of get that overall shape. Now the anterior extension of my wax rim is a little different than in the maxillary arch. In the maxillary arch we use the center of the incisive papilla. In the mandible we're really going to use the vestibular extension. So when I look laterally at the cast, I want to make sure that when I look laterally at the cast that that vestibular extension comes relatively vertically straight up. So here we're checking that, then anteriorly from canine to canine, again following the curvature of the ruler, and then from approximately the canine's back I want to keep these rims centered over the crest of the ridge. So I'm looking at that posterior mark that's on my land area and making sure that my wax rim is centered over that ridge. Okay, so that's my general shape. So vertically up from the depth of the vestibule anteriorly, following the curvature of the ruler to about the canine area, and then the canine area's back, you want to have it extending and centered over the crest of the ridge. So you're going from the canine area and trying to keep your wax rim centered over that line that you have marked posteriorly on your cast. Just like in the maxillary arch, you want to take a hot instrument at this point and you want to sear your wax. Again, if you're really concerned about if you don't use a hot enough instrument in order to sear this wax to your record base, you can put a little sticky wax on your record base first, and that again will help to have this material stick to your cast. So again, just keeping going around the buccal areas, around the lingual areas. We want to make sure that we sear the wax to the record base. Then of course you're going to go back in just like you saw us doing in the maxillary arch. You're going to add wax to fill in any voids so you have a nice clean cast as far as the extensions. You'll use the hot plate just like you saw us use the maxillary arch to make sure you have a nice smooth surface. So again, just continually searing the record base material, the wax rims to the record base material so that they stay connected as one unit. So at this point we should have our overall shape completed. Now we want to look at the vertical height of our wax rim. So just like in the maxilla from this frenum attachment, we're going to go up 18 millimeters. We were going up 22 in the maxilla, we're going to go up 18 here, and then posteriorly I want to have my wax rim go to that 2/3 up the retromolar pad. So keep in mind that your wax rim should be going to 2/3 up your retromolar pad, but the record base material should actually cover the entire retromolar pad. So your wax will actually stop a little bit short of where the record base extends to. Again, taking that hot instrument, that hot flat surface, and heating it up, I can then take that hot flat surface to my cast, and I can sear down the occlusal surface down to those 3 lines, the 18 millimeters anteriorly, and on both sides 2/3 up the retromolar pad posteriorly. So those 3 marks would give me my occlusal plane that I want to adjust this wax rim to. So again, adjusting it, you can see how our wax rims extend to 2/3 up the retromolar pad. Our record base actually extends over the retromolar pad. Okay, so this has the general shape that we want to have. At this point, we could just fill in any voids that we have, add any more material to make sure that it's all clean. But again, straight up from the vestibule, following the curvature of the ruler from canine to canine, and then centering it from the canines over the crest of the ridge, back to that line we drew there. And then anteriorly, we want to have it go from 18 millimeters up to 2/3 up the retromolar pad. So we're just going back over and reevaluating our extensions. Okay, so here again you want it a little bit thinner in the anterior to duplicate the anterior teeth, a little bit broader in the posterior. But we're keeping that posterior segment centered over the crest of the ridge. Anteriorly, as far as the height, we want to go up 18 millimeters from that frenum attachment. Again, that gives us plenty of height of the wax rim material so that we can have a nice height to begin with. It might be a little bit too long, but then we want to have the wax rim, and you can see this wax rim probably goes a little high, but we want the wax rim to go to 2/3 up the retromolar pad. So 18 millimeters anteriorly, 2/3 up the retromolar pad posteriorly. Now the last thing you can do, and this is just something to make it nice and clean and neat for the patient, is you can do a little polishing. Now the first thing you want to do is you want to hit it with a flame. And you want to be really careful with this flame because all you're really trying to do is you're just trying to get a little bit of a wet surface to the wax. You're not trying to let the wax flow or do anything like that. Just hit the wax very briefly. Then taking a very wet paper towel, the first thing I do is dab it like this to make sure I cool the wax so I don't smear it whenever I wipe it, and then I just wipe it with a paper towel. So doing this where you just hit the material with a flame, so you can see I'm just barely bringing the flame into the material just to heat the surface of it, and then coming back in with, again, a very wet paper towel. You can see in a couple areas I may have overheated the material and you start getting it liquefying. Again, at this stage you don't want to liquefy the wax, you're just trying to get the surface to be relatively heated, so then whenever you bring in the wet paper towel, dab it to make sure you don't smear first and then rub, you can get a very high glossy shine surface to your wax rim, and it doesn't take much. Some students like to put some kind of a oil or something like that on the surface of their wax patterns to get them nice and smooth and shiny, and you don't have to do that. Just hitting it with a flame, and then again, very wet paper towel, dabbing the surface first to make sure you cool it so you don't smear it, and then just rubbing it with that wet paper towel. You can get a very nice, high shine, smooth surface to your wax rim. Again, same thing in the mandibular arch going through. Again, not trying to get this material to flow, but to get a nice hot surface. If you have a little void, like you see there's a little bit of a void there in the anterior, you actually want to take a spatula, get some wax on it, and fill in that void, and then smooth it as best you can with an instrument, and then come back in with the heat and the wet paper towel. But again, if you do this, just barely heat the material, just get rid of that little surface luster that's there. You dab it with a very wet, cool paper towel, and then you just rub the wax. You can end up with a very nice, high shine wax rim. Again, something, if you look at the cast, how neat and clean the cast is, you look at how neat and clean the record base and the wax rim are, if you make them nice and smooth, all these things you can do to help impress your patients before you see them. And now you're ready for appointment number 3, your interocclusal record appointment.